New at 10, Fox 4's Abby Eden reports on a national study centered in Kansas City aimed at improving outcomes for new moms.
Jory Stevenson is the mom of two young children, a son and a daughter. Both pregnancies came with complications, but she knows she's fortunate to have had a positive outcome with both.
I knew pregnancy was dangerous, period. Any woman going into labor is going in risking their life.
St. Luke's Women's Heart Center is doing its part to try to change that. It's the epicenter of a study aiming to help women who have cardiovascular complications affecting pregnancy and postpartum. It's a first of its kind study called the HOPE Study. The HOPE Study covers 36 hospitals and 1,000 patients with cardiovascular conditions during and after pregnancy for 1 year. The study will take approximately 4 years. Dr. Anna Grodzinski is leading the HOPE Study.
This collaborative and being in the heart of the nation and really coming as a result of our understanding of adverse outcomes occurring more often in Missouri is really meaningful. We love this work that we get to do, and we know that maternal outcomes are multi-rooted. They're related to a lot of different things.
Dr. Grodzinski says support for this study, both through private funding and the National Institute of Health, is encouraging.
I'm very reassured that there's this new wave and this iterative sort of messaging around pregnancy and the postpartum. It's certainly a process, and we should provide reminders around that importance over time.
Other factors for maternal mortality nationally, according to the Centers for Disease Control, include mental illness, infections, hemorrhage, embolisms, and hypertensive disorders of pregnancy. There's also a need to level standards of care among all ethnicities, regions, and socioeconomic groups.
We also know that in the healthcare community that there may be features or biases that have influenced care. That too is part of the HOPE study, is to investigate to what degree those types of factors may influence outcomes.
Women of color are significantly more likely to die during or after pregnancy. Dr. Tracy Johnson is on the Missouri Maternal Mortality Review Board, in addition to many roles at University Health, including a practicing OBGYN.
I think that is a microcosm of this country in general. I think there's disparities in every single walk of life when it comes to medicine. I think psychiatry, independent of pregnancy, they have disparities, including substance use disorder. I think asthma, definite disparity. Diabetes, definite disparity. Cancer, definite disparity. I don't know of a field of medicine that doesn't have a glaring disparity. And so I think pregnancy in particular is a microcosm of that. I will tell you that while I'm not proud that our disparity for Black women compared to white women is 2.5, it was 3.5. It should be 0. However, we are getting a little bit better.
The process to get better treatment for women during and after pregnancy has not been easy for doctors.
The words I would use are frustrating. I would use really sad. It brings tears to my eyes because of all the women that we've lost postpartum that we're trying to get in, we review these cases regularly and women were trying to get in but they couldn't. So it always brings tears to my eyes because we didn't necessarily have to lose them because they were trying.
But they say maternal health recently became a more common cause among multiple medical disciplines.
But I will also say it's exciting because at least we're trying. 2-3 years ago, when we started to say things like, why can't we get them in? It was like, because we can't. And now it's like, oh, people say how instead of not why not. They say how. And we didn't used to say that.
Jory says while there's still clearly work to do, she hopes this research and continued research into all factors of maternal dangers will build a brighter future for when her children are ready to grow their own families.
It brings me comfort because you bring children in this world wanting to give them the world, and you fear about the things that goes on in the world already. I don't want to add another thing or another fear to the list of things I already have to worry about for my children.
That's Fox 4's Abby Eden reporting. We have this report and her earlier story about mental